Okay, we'll go ahead and call it to order then. Ruth, are you ready?
Yes.
All right. Thank you, Jeff. I see the agenda is up there, but hopefully you've had a chance to look at the packet. Good morning. Welcome to 2022 with the Board of Trustees meeting. So, calling it to order is done, and we're taking a look at the committee assignments. Does anybody have any changes that need to be made to the committee assignments? And Barry and Janine and I looked at those about 3 weeks ago, I think it was. So we should be up to speed with having somebody in place for all the committees that we need to. Any comments or changes there? Okay. Ruth, do we need a motion to approve the committees? Is that right?
Yep.
Or do we just accept the committees as they were presented?
I'll move to accept the committees.
Second.
Thanks, Kelly. Is there a second?
Second. Janine.
Janine, thank you. All those in favor, please say aye. Opposed, same sign. Okay, the committees are in place. Ruth, do you want to talk about conflict of interest disclosures or maybe your progress in getting those?
Sure. I handed them out this morning, and I think everybody that's here has already turned them back into me, so just I'll catch the ones that weren't here today.
Great. Thank you for doing that, Ruth, and thanks everybody for getting those signed off on so Ruth has them in the file. Barry, are you talking? Yeah, you're talking about the Constitution and bylaws for review. Go ahead.
Yeah, I reviewed those last week, and we did make some changes a couple years ago, 2 or 3 years ago, but don't have any changes this year. So, do we need approval? Do we normally get approval for that?
I think so.
Just a motion to reinstate the Constitution and bylaws.
Yeah.
I'll make that motion.
Leona, thank you. Is there a second?
This is Rick, I'll second it.
Rick, thanks. All those in favor, please say aye. 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 Opposed, same sign. All right, those are back in place. And Barry, continuing on with the review of contracts for patient services.
Yeah, pages 3 and 4 are all the contracts that we have with various vendors providing patient services. So I also need to get approval of that list for the next year.
Does anybody have any questions for Barry on that?
A lot of
Entertain a
them.
motion to approve. Oh, go ahead.
No, I just said there's a lot of them.
We provide a lot of services,
Yes,
so
we
that's
do.
a good thing.
Yes.
Is there a motion to approve the contracts for patient services?
I'll move to approve the contracts for patient services.
Thanks, Kelly. A second?
I'll second it.
Kelly, second, moved, and Tom second. All those in favor, please say aye. Aye. Opposed, same sign. That list stands approved. And also out here in Cyberland with us is Christy, and Christy, you're going to talk about the investment portfolio review.
Yeah, so it's in your packet, and I just got it on the screen there. So our investments that we have the New York Life investment, which is a mutual fund that includes multiple different types of investments. We did have a pretty good year on that one. It was at 1.2 million last year. This year it's at 1.9. We did invest another 500,000 in that, but we had a 15.68% return on that investment. The rest of our investments are pretty much just CDs or money markets, which aren't paying very well at all, 0.2%. Our iPay, which is a money market, is 4.4 million. We're working on getting that out of there and getting it invested in some other funds that can pay a lot more than that. We have invested, excuse me, last week another $1 million into the New York Life investment to try and beef up that return. And then we did get some better CD rates from one of our local banks, UBI. So we purchased a couple more CDs to increase that. And we do have we're looking at some more New York Life investment types that are more secure, I guess that are guaranteed, I should say. And looking at if there's any other CD opportunities out there. We are leaving more in our checking account than we normally would because of the advanced Medicare payments that we are having to pay back over the next year, which is about $7.5 million. So we do still have quite a bit of cash in our checking account. But overall, for our unrestricted investments, we saw a 1.98% increase return on investment. We have $10.2 million in there. Some of our other investments are our investment into Health Partners of Southwest Iowa. And the reason there's no change in that is that audit hasn't been finished yet, so they haven't given us the adjustment to increase or decrease our value in that. And the Berkshire Hathaway, we saw quite a bit of investment increase in that at 28.95%. So overall, without reporting the Health Partners investment, that was a 16% return on our investment for those other assets. The board designated assets, which are health, self-insured health plan funds that are sitting there. We have some CDs with UBI, and then we have most of it in a money market account at Shelby County State Bank. So again, it's bringing us about 0.2% increase. We don't have any reserves anymore for debt because we don't have any debt. So overall, our return on investments this last 12 months has been 3.18%, which is down a little bit from last year, but still somewhat decent. So we have almost $13.3 million in investments. Any questions on that?
I was just going to comment that all the different rates you just shared, overall 3.8 does, you're right, not sound terrible for where we are in the big picture of things right now, Christy.
Yeah, the banks don't really need our money, so they're not wanting to pay any interest rates out, so we're doing the best we can with it and still stay within our policy and our risk that we're willing to take.
Comments, questions for Christy? Otherwise, I would entertain a motion to accept the review of the investment portfolio.
I so move.
Thanks, Janine. Is there a second?
I'll second.
I didn't catch who did that.
Kelly.
Kelly, thank you. All those in favor, please say aye. 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 Opposed, same sign. All right, the investment portfolio has been reviewed. Thanks for the update. Are we missing Jim this morning? There is no Jim here.
That's correct.
Thank you, Ruth. Okay. All right, we are up to Janine. Welcome to chairing this meeting. So I will turn it over to you as you get the approval of the minutes, and best of luck in the next couple of years.
Well, thank you, and thank you, Terry, for what you've done the last couple years.
My pleasure. Thank you all.
The minutes have been provided to you, so if I could get a motion to accept as presented.
I'll make a motion.
Leona, second.
I'll second.
All in favor?
Aye.
Aye.
Okay, Karen?
All right. Medical staff meetings. So we have basically 2 medical staff meetings to go over with you, both December and January here. So December med staff meeting was December 14th, and I'll kind of skim over because some of this is old news, because as we know, COVID changes on a dime around here. So the biggest thing at that time was we did have confirmed cases of Omicron in Shelby County, which we all already know about. We did talk with the medical staff that our rapid tests do detect that new variant. So that was, again, kind of old news now. They have been approved for emergency use authorization for monoclonal antibodies for pediatric patients. Again, that's a little bit of old news now because we can't even get the monoclonal antibodies. Those are all dictated from the state, and we get a certain allotted amount every week, and basically what we've had, we've already given out to patients. So, Red Cross, talked to the medical staff. They've had having difficulty obtaining blood from volunteer blood donors. It's not just from donors. They have donors who are sick and can't donate, but they also have workers who have gotten COVID, so they don't have enough workers to work the clinics. So they had a immediate fulfillment restriction at that time. So basically, if you were needing blood, you had to ask for it, and they were having some restrictions out there. That is actually advanced now, where they've actually given out all blood. They don't have any blood on their shelves except what they have coming in and are processing. All of the other blood has now gone out to all hospitals. So it's been a little bit of a challenge. We've had to work with other hospitals if we need a specific type of blood or something that we don't have on hand. So it is getting a little bit serious on the American Red Cross blood. So anybody who can go out and donate, I would certainly encourage them to do that. 2022 committee assignments and a physician advisors list was approved. A few changes noted from 2021, but that was approved by the medical staff. So then I'll switch to the January meeting, which was January 11th of 2022. So again, talking about the monoclonal antibodies, there are some new ones out now for Omicron. Sotrovimab is one of the big ones that we are using, and again, like we talked earlier, those are being sent out by the state, so we only get our certain allotment each week. Adam Porter, one of our pharmacists, came and talked with the medical staff and went over the ins and outs of all of these new medications. He also went over the oral therapeutics, so now there are some preventative oral medications that are out there that doctors can prescribe. Oftentimes these are used for patients who are severely immunocompromised to try and help prevent them from getting Omicron or the COVID virus. Those are all sent directly to the pharmacies. None of those will come to the hospitals, but the pharmacist went over with the medical staff what to look for and who to prescribe those for. Isolation guidelines. So there were some changes from our Department of Public Health on isolation in the public. So if you've been exposed to a positive COVID patient, they've moved the isolation down from 10 days to 5 days. So went over that with the medical staff. So the 5 days you have to be on isolation. The last 5 days you have to be wearing a mask continuously. The hospital has done a similar process. We can designate whether we want to be in conventional, which is normal operating mode, or crisis, which is obviously the other end of it. We've kind of chosen to be in the middle of that, a contingency mode. So again, same type of thing. They've moved our isolation from 10 days to 5 days. So very similar to the public for our healthcare workers. Revised their policy for hypoglycemia for the neonate or the babies. We adapted this from Women's Methodist Hospital, and the medical staff approved that. Dr. Shu will be coming to Myrtue Medical Center. She introduced herself to the medical staff, came and talked with them. She's a hand specialist with Miller Orthopedic, and she'll be coming out the second and fourth Thursday afternoons of each month. And those are the big things that we went over at Med Staff meeting.
Okay. Any questions for Karen? All right. Ann?
All right, so for behavioral health, Lindsay Kinney looked at documentation compliance, and then they also looked at overall patient satisfaction, which was 99%, and 100% of patients recommended the practitioner or department to a friend. They answered that question at 100%, so that's very good. Cardiac rehab, Nicole Olinger and Tammy Blatt looked at goals assessed on discharge. For diabetic education, Jan Hastert looked at the hemoglobin A1C levels, and I know we talked about this before. So we look at the hemoglobin A1C, which is for diabetics. We look at that before and after they receive education from Jan on how to manage their diabetes. And so before, their levels was 10.3, and we want at least a 1% decrease. And so after education, it was 6.7, so excellent results. For home health, Tina Holzworth looked at hand hygiene, and the laboratory, we gave 36 units of blood, and Karen talked about the blood shortage. And so I wanted to give a warm welcome today to Laura Friend, who has been hired here as my replacement. Laura brings 22 years of nursing experience to this position. Laura has a variety of background, including surgery, home health and hospice, acute care oncology, and for the past 6 years, she's been the education coordinator here at the hospital. Laura is going to serve this role very well. But I have to tell you a story that's kind of ironic. So I saved various educational materials throughout the years. And one of my favorites was this. It's like 2 foot tall by 3 foot wide poster of a consent form that was completed perfectly. And it was from like 2007. I saved it all these years. And so guess who the nurse that signed the consent form? Laura Friend. So Laura got that on her first day. So in ending my tenure here at Myrtue, I want the board and community to know that Myrtue is unique to have 3 board members on their quality improvement committee. That shows the board's commitment to quality, as not many facilities have this structure in place. Administration and all staff in Myrtue demonstrate a team effort, and I emphasize team, because no one can do this alone. To consistently improve patient care, we have an environment of learning and excellence. I can tell you the CEO, Barry Jacobson, truly cares about patient care, and he is a driving force for us to always be on the cusp of evidence-based practice. All of us that are older here in the room knows about the TV series, The A-Team. And my kids live this, so I know the A-Team inside and out. And everybody knows their famous quote, "I love it when a plan comes together." And so I want to show a picture that I made several years ago of Myrtue's A-Team at that time. And I just want to say that Myrtue does a great job of making plans come together, working as a team. So thank you.
Oh, that's cute. Thank you. And welcome, Laura.
Thank you.
Next is the credentialing report. Tom, it looks like you're going to present that.
Yes, relatively short report today. We do have 5 initial appointments, one in consulting radiology, another in consulting fellow psychiatry, another in consulting orthopedic surgery, and then 2 in advanced practice professionals. We have 3 reappointments, one in active family practice, one in advanced practice professional, the third was consulting fellow radiology, no voluntary withdrawals, no issues with any of the candidates, so would move for approval of these appointments.
Okay, can we get a motion on that, please?
I can make a motion to approve that.
Thanks, Rick.
I'll second.
And Kelly seconds. All in favor?
Aye.
Opposed? All right, Mr. Jacobson, we are up to your report.
Yeah, I wanted to give you a kind of an update on what the Iowa Hospital Association is looking at for their 2022 legislative priorities. So this is really, a lot of work has already been done on this with the different councils during the 2021 year. The board of trustees and all the various councils have been working towards pulling this together. So obviously the biggest issue right now is workforce. It's the biggest challenge for hospitals, highest priority for IHA's 2022 legislative agenda, definitely across Iowa hospitals facing critical workforce shortages. For Myrtue, currently it's a combination of staff that are out with COVID, which we see as a short-term issue. And the longer-term concern, of course, is just the general workforce shortage that's really likely to be affecting hospitals for a number of years to come. But like I said, we do have several staff members out with COVID right now. We feel this is related to the current surge. It'll work itself out over the next few weeks and months. But again, the larger and longer-term issue is general workforce shortage. Hospitals are struggling to recruit, hire, and maintain medical professionals and staff in many areas. Here at Myrtue, we're doing fairly well in this area. The only active recruitment ongoing effort for providers is a CRNA. We normally have 3 full-time CRNAs, and we had one leave back in October, so we're using a locum tenens company right now to fill in during that time, and that's working okay. It's not ideal, but it has worked okay in the interim. But with regard to just our providers, doctors and mid-levels, that's really the only position we're looking at. Other than that, we're at full staff. We do have 8 full-time nursing positions. So when I say nursing, I'm talking about RNs, LPNs, CNAs, CMAs. So we have 8 full-time nursing positions that we're hiring for, and 8 other full-time positions from non-nursing positions that we're hiring for right now. We do have several part-time and on-call positions that are also open. So that's higher than normal, but definitely is higher than what we normally have for open positions. So it is concerning. We have implemented some recruitment efforts, mostly in the nursing area, that are, I guess we consider them to be temporary, but there's different things that we're doing, sign-on bonuses and different things like that to try to recruit nursing, but really we're focusing more on retention. So there has been retention incentive bonuses that have been put in place here in the last couple months. So I think that's definitely being well received by our nursing staff. We are meeting the needs of our patients with people filling in and helping out where it's needed. I think the bonuses, the recruitment and incentive bonuses are helping with that as well. We do occasionally have times when we have to cap our inpatient census because of staffing, but we're trying to keep that to as much of a minimum as possible. And some of these recruitment and retention incentives include incentives that incentivize nurses in other areas to fill in on the med-surg department as well. So that helps in filling that need as well. So IHA's position with regard to workforce, and I think this is really pretty high level, I think it's kind of a work in process, is to continue to develop and fund programs that demonstrate improved recruitment and retention, expanding training to increase rural access to education and increased incomes, increasing reimbursement for medical professionals, investing in initiatives that bring medical professionals to Iowa to live, work, and grow, and then reducing different administrative barriers that make hiring and retaining employees more difficult. So like I said, those are, I don't know that they've really worked to drill down what that actually means in some areas. I think there's quite a bit of work to do yet on kind of their workforce agenda as they move forward, but they certainly recognize that this is really the biggest issue that we have right now. But moving on, some of the other areas that they're looking at from an operational standpoint, tort reform is certainly one of those areas. It's high on their priority list again. It was a lot of work done on it a year ago. And really, they're trying to push for a hard cap on non-economic damages, so things like pain and suffering and emotional distress. So trying to get a cap on those in malpractice liability cases. So some of these unlimited jury awards really can have an effect on the ability to recruit physicians and nurses to Iowa. So that is going to continue to be a focus into 2022. The rural emergency hospital designation, IHA was really a leader in the nation in trying to put this designation in place. I'm not sure that it makes a lot of sense right now in the middle of a pandemic, because really what it does is it allows small critical access hospitals to give up inpatient care but get reimbursed better on the outpatient side. And there are a lot of hospitals, small hospitals, that maybe have a census of 1 or 2. And it is kind of questionable whether it makes sense to have an inpatient unit that's very expensive to maintain when you only have that kind of a census. But right now, when we're struggling to find beds in the middle of the pandemic, it doesn't really make sense for anybody to give up inpatient beds at this point. But that still is on the agenda. IHA invested a lot of time in that, and I think it will make sense down the road. Vaccines, IHA did take the position that hospitals should be allowed to determine their own clinical response, including vaccination policies based on unique factors and circumstances affecting their areas. So really, wasn't sure how that was going to go, but because I could see there being quite a bit of debate about whether they supported vaccine mandates or not. But really, they're taking the position that each individual hospital should be able to make that decision on their own. CON, Certificate of Need, that is always on the agenda. There's always a challenge to Certificate of Need. And really, it's very important for hospitals like us that it be in existence. There's a lot of, for-profit entities or ambulatory surgery centers that try to come into Iowa, and this really kind of keeps them at bay a little bit. And they don't, a lot of times those entities don't take Medicare and Medicaid patients, which we do. They don't have emergency rooms that are open 24/7. Which we do. A lot of times we might have 1 or 2 patients is all we see in an evening, and you have to have physician availability, you have to have nursing availability, you have nurses on staff, radiology lab. So there's a lot of things that we have to do as a community hospital. The community health needs assessment that we do every 3 years. There's a lot of things that we do, that services that we provide that lose money. And these other entities aren't going to do those kind of things. Disaster preparedness is a good example of, we really have a huge involvement in our disaster preparedness in Shelby County. So CON is important. I'm not familiar if there's a specific situation this year where someone's trying to come into Iowa, but every year it's something we have to work on. From a fiscal standpoint, so there's the cost adjustment factor, and this is they're proposing to increase that from 1.5 million to 6.5 million, and this really relates back to when Iowa converted to the Medicaid Managed Care program. We lost our cost-based reimbursement, so we did lose reimbursement when that happened. It's probably been 5 or 6 years now when that went in place. But the CAF is a formula that gets back some of that lost reimbursement for critical access hospitals, and this change would generate about $17 million in extra reimbursement for critical access hospitals. So I think that's important. The days awaiting placement reimbursement. We are advocating that we have some reimbursement for that. So we have a lot of times where we'll have patients, a lot of times mental health patients, that we're keeping them either in the emergency room or on the med-surg floor, waiting for a placement at another facility, and we get no reimbursement for those situations. And so that's one of the push right now from a hospital reimbursement standpoint. Medicaid program, just some push towards more consistency with the way those payers are handling that program. Things like prior authorization procedures, billing and coding consistencies. So that's another focus. And then, of course, behavioral health. Really, there was a lot of work done a few years ago getting some of these different services developed, but there was really no funding to back them up. So that will continue to be a focus moving into next year as well. I think that's most of the items that I had related to the legislative update. I did have some things on our medical staff meeting that I maybe just go real quick through. This is things that was presented to the board or to the medical staff. Just the Bryan telemedicine, we did sign a contract, and they will be, we're expecting them to start February 8th. And they are going to use a different group out of Lincoln as opposed to the group that we used back in 2020, which is a group out of Florida. But we think that's going to be a good service once we get that in place. The Dr. Base, we're about ready to sign the contract for neurology services. We will lease time from the Carroll Hospital, who's employing that individual. So we'll get him a couple days per month. And that should start actually in March. We think that's going to start either March, I think March 7th is the date that we're looking at. We did talk a little bit about telepsychiatry, which is something we've had in place for, it's probably been about 3 or 4 years, and I think we just wanted to talk to the medical staff and make sure that they were satisfied with that service. And we're able to confirm that that is a service that's needed and providing the service that the medical staff needs in the emergency room. I did talk to the medical staff about the nursing retention bonuses that we put in place, so they are familiar with what we are doing from that standpoint. Other than that, I guess I would just like to recognize Terry Turnitin for his time as our board chair over the last couple of years. This would be a lot easier if he was actually here, but I do have a plaque. I don't know that Terry thought that he was going to, his 2-year term would be dominated by the pandemic, but we didn't put that on the plaque, but maybe we should have. So I'll just really read this to you, to Terry. This achievement is presented to Terry Turnitin in appreciation of your outstanding leadership, commitment, and service to the Myrtue Medical Center Board of Trustees. Chair Board of Trustees, January 2020 through December 2021. So, Terry, when you're here in the hospital again, we'll get this plaque to you, and definitely appreciate your service over the last couple of years. And that's all.
Thanks so much, Barry. I appreciate that. And yes, I won't be a stranger. I'll still be stopping by. And as I listened to Ann's comments this morning, I would just go back and I agree with so much of what she said. And, you know, I've appreciated your good counsel and guidance, Barry, over this past couple of years. I hope there is calmer waters and smoother sailing ahead for Janine, and everybody at Myrtue continue to work together and do great things for our community. So thank you so much.
Thank you, Terry. Thank you, Terry. Is that it, Barry?
Yeah, I think that's all I have.
Back to the, just a comment, back to the recruitment and retention. And that's is it a national problem? I know it's felt more than just in Iowa.
Yeah, it's definitely a national
Yeah.
problem, and it's not really just healthcare. I mean, it's everything right
That's
now.
true.
But we're definitely seeing it affect us a lot.
Right.
And more so in nursing side, but really in every position.
I would agree. Tough times. All right, it looks like the rest of the agenda is owned by Christy Hansen. Are you ready?
Yep.
Okay.
So the first thing we have on there is every year we adopt the IRS mileage rate for a reimbursement to staff that have to use their own vehicles. It did increase to 58.5 cents for 2022, which is a 2.5% increase. So we just need approval to increase that policy.
Could I get a motion on that, please?
I'll make that motion.
Second?
Second.
Thank you, Kelly. All in favor?
Aye.
Opposed?
So the corporate resolution, there was no changes on that. We just adopted that October, I believe. So there's no changes. It just says who we have the authority to deposit funds with and the maximum that we anticipate that we'll have in each of those entities. So just approval of that resolution again with no changes.
Okay. We could get a motion on the
I'll
corporate
move
resolution.
that we approve the corporate resolution.
Okay, thanks, Terry.
Oh, I'm sorry, that's for the bank signatures for that. Sorry about that. That's for the bank signatures for the change in the chair position. So I'm sorry about that.
Oh, there is a change now.
It's for the new officers.
Okay, new officer.
I will still go ahead and move that we approve that, Christie.
Okay.
Second, please.
I'll second it.
Thank you, Rick. All in favor?
Aye.
I
Opposed, same sign. Okay. The financial statements, Christie?
Okay. Okay, so we didn't have November at the last meeting completed, so it's in your packet also. Just kind of go over the bottom line on that one. So for the month of November, we had $130,000 in operating income. We did in November receive some additional payout for federal stimulus money, and that helped us covered any lost revenue and expenditures related to COVID that we had left over after we received the last federal funds. So we recognize that as income because it's basically already been expensed, and we're going to use some of that money was also used to fund like the portable x-ray machine things that are essential for us to fight COVID, to better serve our patients. So we did receive $1.3 million in that, so really we had $1.6 million in net operating income in November. Year-to-date was $2.1 million in net. We just did want to note that in October there was we did a change in vendor for our 340B program, and there were some accruals based on past history, and then there was a change when we went to that vendor, so it reduced our income by about $100,000 from what we reported previously in October. But that should come back to us. It's a correction they need to make, but so that will correct itself over time. But we did make go back and restate October for that change. I can go ahead and I'll go through December here, and then you can do approval for both of the financial statements. So as of December 31st, in December we had 6,356 outpatient behavioral health visits, which was up considerably from last year, 4,934. As you can see, year-to-date, we're up about 1,200 additional visits compared to the previous 6 months of 2021. Excuse me, those dates aren't right, so sorry about that. So the emergency room visits were December of 2021 were 491 compared to 343 last year. We're up about a little over 650, so we're up to 3,000 visits to our ER in the first 6 months of this fiscal year. Surgical procedures are 113 in December compared to 142 last December. We're at 702 compared to 731 the previous year. Again, clinic visits for the RHCs, it's 4,160 compared to 3,397. We're up to almost 24,000 visits in the 6 months of the fiscal year compared to 20,500 for last year. As you can see, our average daily census was pretty high in December of 13.11. It was 12.33 last December. Year to date, we're at 9.48 compared to 9.17. The best news there is our births. We were down in December of this year for 4 compared to 6 last year, but we still are up 43 in this fiscal year compared to the first 6 months of last fiscal year, which were only 24. So that's great news there. If you look at our operating, pretty much break even for our operating revenue over operating expenses. We have $511,000 in non-operating income. So our net income for December is $668,000 compared to $641,000 last year. Year to date, we're at $2.8 million compared to $1.6 million last year to date. So we are doing better this fiscal year than we were last year. So we're still hanging in there, doing a good job of meeting our expenses. Any questions on the financial reports?
Questions, anybody?
No.
Okay, if I could call for a motion on that, please.
I'll make a motion to approve the financial reports.
Thanks, Kelly. A second, please.
I'll second.
I'll second.
Yeah, plenty.
Take your pick. Who's the second? Rick, all right. All in favor?
Aye.
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 Opposed, same sign. Okay, Christie?
Payroll claims were in your packet. There's nothing out of the ordinary. We're seeing, we're trying to get, we're getting a few more supplies in, so those expenses are up a little bit, but we want to make sure that we're prepared for any more changes in COVID. So it's a good thing that everything's not back ordered.
That's true. Any questions for Christie on the claims as presented? If not,
I move we approve the payroll and claims as presented.
thank you, Terry. Second, please.
I'll second it.
Thank you. All in favor?
Aye.
Opposed, same sign. One more item.
Yeah, so we need to approve a public hearing date for our our county budget that needs to be filed the first part of March. So I would ask that we could approve a publication for a public hearing date of February 22nd, 2022 at 7:30 a.m. in the Oval Room for any public comment.
Can I get a motion for that, please?
I'll make that motion.
Thank you, Rick. Second?
I'll second it.
Thank you, Leona. All in favor?
Aye.
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 All right, I think that concludes our,
One thing I missed, I was gonna have Jeff do a quick update.
Oh, sure.
Cup
Great.
project.
Yeah, so the cup project, since the last meeting we had, you've noticed we got a lot of concrete poured, so the drive is open again for the nuclear med and the MRI trucks to drive through instead of having to try and back up during slippery times here. So that was a great project to get finished there. We also have poured the footings for the retaining wall and the fence that goes around the chiller yard that's out there. Poured a bunch of pads, set the condensers on the pads as they are, and the plumbing is being hooked up to those to be ready to be turned on in the next few weeks. There's a lot of interior work going on also. We removed the last chiller that was in the central utility plant so that we could demo concrete, put in a new pad for the new boilers to go in. So progress is being made. A lot of times you don't get to see it because it's all inside of the plant, but we're making some good progress.
That's good. All right, so I need a motion for the adjournment if we're ready.
I'll make the motion.
Thanks, Rick.
One second.
Thank you, Terry. We are done.